cloud. Got it. Good. Thanks for walking me through it.
Oh, why my screen's paused? Okay. Now it works. Okay, good morning, everyone. I'm Youngju Lee, assistant professor here at the School of Nursing, and also the co-directors of eHealth Hub, and one of facilitators of the core that I'm going to introduce today. Well, we all know about the quick the introductions of the eHealth, which define as the use of emerging informations and communication technologies, like internet, mobile devices, nowadays also the wearable devices, to improve or enable health and healthcare. And it holds promise for promoting health, well-being, and reducing disparities for individuals and groups. So the overarching goals of our hub is first to those who are conducting research in any types of eHealth space. Second, share a range of methodologies and perspective. Third, support the inclusions of patients and consumers in the co-creation of eHealth solutions to maximize their benefits and reduce their risk. And fourth, support the developments of funded projects for individual investigators and convergence research proposals. So to this end, we established 2 cores to cluster members with the similar interests. One, which actually introduced the previous the core meetings, the interactive health technology course that focuses on interactive technologies for the assessments and delivery of interventions that applying the principles of user-centered design justice, and strategies that support long-term engagements in the use of technologies. And well, there are so many, but some of the examples can be interactive smartphone apps, web or telehealth targeting specific health and self-management behaviors. And today, well, I would like to introduce our health informatics and data science course. And Salah is also the one of facilitators here that focuses on developments and use of method and technologies to acquire, process, and study data and discover and manage new knowledge relating to health and disease in individuals, groups, families, and communities. Well, some of the examples, but not limited to, is data-driven, is more like the data-driven research and discoveries, artificial intelligence, machine learning, and predictive modelings, like clinical data minings, secondary use of the EHRs, natural language processing, and design of clinical decision support tools, and human-computer interactions. So, well, our facilitators are Dr. Salar Zahidis, Teresa Colex, me, myself, and Faye Zangs. And today, well, because of the schedule conflicts, Teresa and Faye couldn't make it, so Salah and I are going to present on behalf of our facilitators. So the goal of our core is to support the research that focuses on developments and use of method and technologies to acquire, process, and study data, and discovers and manages data-driven knowledges. So some of the examples, again, the predictive modelings, clinical data mining, natural language processing, design of clinical decision support tools, and human-computer interactions. So we are all welcome to, our researchers, our collaborators, and the students who are interested in, this type of the research. So the services and activities, well, first, providing the educational opportunities like courses, lectures, journal clubs, and seminar series, and also providing support services like sharing computational resources, consultations, and review specific aims, and also research and building the research collaborations. Like we can invite guest speakers in these areas, providing the networking opportunities, and also introducing some of the grant opportunities related to our core goals. So now I would like to hand it to Salah. Yeah.
Okay, so thanks, Youngji. So we started putting these ideas together about what can we provide in this core, because we've been working together in the eHealth Hub for years, and it's the same group that has been meeting. Now, since we are going into two different cores, we started thinking about what would be so unique in our core in terms of what we can provide to those who would be affiliated in this core. And on the previous slide, Young Ji went over what we envision would be services that we would be providing. And one of them is training opportunities. And under that training opportunities, we thought, data science is a very, uh, a largely growing field, and a lot of people really want to get on the wagon and start implementing data science in their work. Now, this field, although it's so appealing, it's running through tons of issues, and there's lack of training for clinical scientists about the use of data science. And the consequence over the last decade or so has been a lot of machine learning engineers and data scientists who are working in silos away from clinicians. At the same time, we have clinicians trying to implement data science applications without the work with machine learning engineers. This eventually led to problems in the field where everything's sort of like divorced. And there has been a lot of efforts in the field to try to bridge that gap, which is, we really need to reach that common ground and have clinicians and data scientists working together, and they both understand each other. And this is an example of an effort that I led over the last 3 years, working with groups from University of Pittsburgh and UK, and I believe Canada, trying to put this clinician guideline together. And this was published in the European Heart Journal. And in here, we put together a clinician guide to understanding and critically appraising machine learning studies. At the same time, we provided a tool called a checklist for rolling out bias using standard tools in machine learning, or robust ML. And this was one of the initial steps among many efforts in the field to get people to know, or get clinicians to understand data science, at the same time to be smart users, understand the field, know the pitfalls and the gaps, because we don't want to run into what's happening in the field right now, which is a plague of pilots. So hundreds of applications that use machine learning about a single problem. None of them is, commercializable. None of them is working on the bedside, and all of them are non-translatable. So the idea was, the first idea, we really wanted to bring this, knowledge to people affiliated with the eHealth Hub, and the interest might be beyond the school. So one of the things would be running a seminar series that actually covers the information that's covered in this clinician guide. And there was a discussion I had with Dr. Yvette Conley at the PhD Council, where we can actually, and this was also with the other vice chairs for research, about running a seminar series in the School of Nursing that's not only open to the eHealth Hub, but also to other people, at the School of Nursing or other health sciences. We envision right now a three lecture series. Each lecture can be 1 hour, but they are like, they build on top of each other, where we can go, over the foundations of machine learning and critically appraising machine learning studies in healthcare. And I believe I spoke to Dr. Sirika, I think she's here, at some point, and we thought maybe this can be part of the of that brown bag seminar series on Mondays, if we are able to fit, like, 3 consecutive lectures, in a row. It can also be delivered in part of that Monday series as well. So can we go to the next slide, please? Okay, so for the next few slides, we only have simple research highlights about the facilitators of this hub and the type of work that they are doing, trying to explain how this fits within the health informatics and data science core. And these research highlights are listed in alphabetical order. So, so starting with what I do here, many of you are familiar with what I do, and some of you might not be really very familiar, with the type of work that I do. So this slide sort of like summarizes one of the studies that I'm currently running. This is an R01 funded by Heart and Lung. It started back in April of 2018. And we are right now in the second renewal of this R01, and this R01 goes until 2026. So this is a study called Empire, EKG methods for the prompt identification of coronary events. So what we are doing with this study, it's a pre-hospital network where we have a network of 15 different EMS agencies in the city of Pittsburgh, responding to patients who call 911 for chest pain. And what we are doing is we are working with the medical command center for every patient who gets an EKG in the field. We work with them to remotely transmit these pre-hospital ECG to the command center before the patient arrives to the hospital. And what we are doing with in terms of data analytics, we're taking these ECG signals. They all come in XML format, so they are all digital. So we extract them, we do signal processing, featureizations, feature extraction. Then we go into numerous machine learning classifiers to build predictive models as clinical decision support tool that can be used by physicians at the command center while the patient is still being transmitted to the receiving hospital. And this work has been going on for a while. We roughly have around 4,000 patients already included in this study, and we had numerous papers already published about this, and we have a US patent that has been issued in 2020. And this technology right now is being licensed to Philips Healthcare, who showed a lot of interest into this, system of care, and trying to take it. And if this licensing agreement works out, hopefully this can be widely disseminated across pre-hospital systems of care across the US. Can you go to the next slide, please? And okay, thank you. And this is another study that I want to highlight about what we are doing in terms of informatics and data science. This is another R01. This is funded by NINR, and this is the third renewal of this very same R01. Marilyn Hravnik was the PI on the first two grants. And after she retired, I took the lead on the same project, and we were successful in getting a third renewal in February of this year. And this new R01 is going to go until 2025. So this study is called PINC, or Predicting Patient Instability Non-Invasively for Nursing Care. So what has been done so far is we have almost 50 beds in step-down units and ICUs in Brisbane. They are all connected to different, a database server called DWC, or Data Warehouse Connect. And what we are doing is we are extracting data from the EHR and mapping the data to the physiological data coming from these monitors into another SQL server. Then from there, we take all of this data, we build analytics to try to forecast instability. And we are all familiar with, the concept of alarm fatigue and the very poor precision and positive predictive value of alerts causing all of these alarm fatigues. And as nurses, we know that you keep, going to the bedside monitor and just silence the alarm because most of the time they are, false. So we are trying to do twofold things. One of them is to reduce the rate of these false alarms. And so far, our machine learning models have been able to suppress 92% of false alerts without any additional intervention. And the second thing that we are trying to do is actually move the needle forward from responsive to preemptive intervention. So in other words, rather than detecting instability as it happens at the bedside, so say that the patient is having desaturation and the O2 sat is dropping, rather than detecting that in real time, which is what these bedside monitors do, are we able to forecast that? So in other words, can we predict that, say, an hour in advance? Now, this might sound like voodoo science, but if you think about it, this is what we do as clinicians. We have that clinical gestalt. When we assess a patient, we can tell that the patient is under distress, and maybe there might be compensatory mechanisms going on before we eventually see the desaturation on the monitor maybe an hour later. So we can see these things. We call them clinical gestalt. That's what we are doing with our machine learning models. We are trying to detect these hidden patterns in the data to actually forecast, to tell in advance that although my vital signs might look fine on the monitor right now, but maybe this patient is heading into deterioration. And it's a complex, study protocol where we have a clinical trial piece, we have a graphical user interface design underway, and eventually at year 3 and 4, we're going to deploy this model here at Brisbane, and then we will go into an external site. This is a multi-site clinical trial where we'll have the same model deployed in UCSF to see, the external validity of that model. So I'm gonna stop here. I don't want to, talk too much. I already talked too much. So I'm gonna, if you go to the next slide, I believe we will have highlights from another facilitator. Youngji, you wanna take this one over?
Okay, yeah, I think I can take from this here, yeah. Okay, so on behalf of Teresa colleagues, I'd like to introduce her research. So as you can see, so we today's the examples of the research actually highlights a very various types of the data science. One is the last one is like the predicting models with the EKGs, and for Teresa's work is we utilize the secondary use of the EHRs to to develop the EHR characterization pipelines, especially an optimized sequence of data processing and analysis steps for patients with chronic conditions. So she's been working with the R3, the UPMC, in order to get the UPMC clinical notes, and also working with the all of us research programs in order to get more enriched data and self-reported data from the patients. And and her main activity is generating comprehensive symptom vocabularies and extracting symptom information from clinical notes using the natural language processing. So in order to extract the information from the natural language processing, I mean the clinical notes, most cases is very unstructured, just free notes. So in order to build the models or analysis, you need to have some structures or the standards that in order to understand and extract the information. And one of the Teresa's the approach is building the vocabulary and dictionaries about the symptoms and related information, so she can match and extract the information from the unstructured free clinical notes. And also the second activity would be developing method to determine symptom enrichments from structured EHR symptom billing codes. So it can be now the map to the structured informations. And the last one would be examining symptom cluster in patients diagnosis with one or more chronic conditions from EHRs using unstructured data analysis techniques. So well, just my ends, I know that most of the symptom data are right now still in unstructured way, because there are very few simple questionnaires for nurses to assess the symptoms, like the symptom severities or the symptom types, but other symptom related information, which is huge, but still it cannot be captured in a structured way. So Teresa's work will be building the pipelines to make the connections with the unstructured data, and also link to the actual billing codes, so it can have more complete profiles of the symptoms. And now move to my next works. So this one is different from the Salas and Teresa's work, which is focusing on the patient-generated health data. So when we think about the data, there are, well, the data, most of the clinical data are coming from the EHRs or the hospital side, which is generated by the hospital, the clinicians, or it gets some of the clinicians. But still, we believe that patients are also providing the information which cannot be captured in the clinical settings because too busy, and the EHR have a limited structures or the sections. So many of the patients or the caregivers are turning to the internet, the virtual world, and providing the information and their stories. So my research has been focusing on this type of the data, PGHD, patient-generated health data, in order to understand their values, their preferences, thoughts from their free text stories. So this study is in the combination of natural language processing in order to extract information, and also the artificial intelligence to build the recommender systems. So currently, they're funded by the NLM, the R1 study, the health librarians with personalized recommender helper studies. The goal is to develop the personalized information access systems with a hybrid recommender engines that adapt to the individual aspect of the patients. It's like the Google for ovarian cancer and ovarian caregivers. So once you log into the Google and search for the information, just Google give you the tons of the unfiltered informations. But for us, especially the patients, the groups, ovarian cancer patients and their caregivers, which defined as the rare cancer by the NIH because of the small number of the patients. Oh. Yes. So I think someone, the mic's turned on.
And they kind of shift a little bit away from COVID things.
Annette, could you unmute the Elizabeth's mic? I think she's. Could you do that? Okay, thanks. So we would like to help them to get their personalized, to get the information to very relevant to their needs based on their trajectory, their knowledge level, and their preferences. So this system is what humans and AI collaborations. They're replacing a traditional static recommendation interface with a more interactive recommender systems where users have more opportunities to find relevant information while informing the systems about their needs. So again, the data source is two ways. One is online health information from the various websites, including the PubMed and like the cancer, the NCI or the American Cancer Societies, and also including the net blogs from our ovarian cancer survivors. And also we are collaborating with the National Ovarian Cancer Coalitions in order to access to their online health forums. So the main activities are, since it was very first versions, so we do need to get the actual input from our patients, caregivers, and also the clinicians in order to validate all the informations. So we are interacting with the patients and caregivers to understand their contextual factors about their information-seeking behaviors, and also conducting natural language processing to analyze the information written in the NOCC online health forums in order to understand, the patient's actual needs and all the, background stories, and developing knowledge-based algorithms to personalize online information. So this is the simple pipelines of the websites. So one of the innovative part is we are including the humans experts, our nurse curators and the domain experts in these loops in order to validate and build the more accurate the algorithms. So the patients and also the nurses can using our systems and keep providing the information, based on their feedbacks, also they can also rate the information, whether this information is really relevant to their situations or not. So all this feedback will be feeding into our algorithms and keep improving the accuracy of the information. And also from the online social sites, one of the benefit is, patient and caregivers keep writing the postings. So still, it is very limited to get the actual information from the patients in person, via the interviews. So all this information will keep feeding us to understand patients' contextual informations to build the models. And another part is we have our libraries, including all the validated data sets, and also including one of the Heidi's previous, the R1 studies, right symptom studies, which is evidence-based symptom management strategies for ovarian cancer patients. So not only the online sites, but we are also trying to include the other existing evidence-based, the documents to the libraries, so patients have access to, look into all these type of informations. So that's the simple the stories of my current research. And our last but not least, Zhang's. So now another type of research, which is based on the UPMC anesthesia data, and also working with, building the information management systems. So this study is developing and testing a deep learning-based expert systems to validate the ideas of improving pre-operative risk assessments and intraoperative management through the large volume of high-fidelity data and also corresponding anesthesia management data. So right now, closely working with the UPMC anesthesia teams, because also Faye is anesthesiast. So the main activity is create an objective data-driven approach for the preoperative risk assessments of high-risk patients, building the virtual database to provide unlimited high-fidelity intraoperative data for training deep learning algorithms, and establish a data-driven approach to mimic the interoperative decision-making processes of anesthesia providers. So, this is really the part of our course, and we are really open to anyone who is interested in, data-driven sciences, especially focusing on nursing and also the patients and caregivers. So the upcoming the session will be on November 10th. We are inviting the Dr. Ravi Pedal from the pharmacists to discuss about the future collaborations of between the School of Pharmacies and our eHealth hubs. And we are still opening for the the sessions for December 8th, January 12th, and on January 26th, we have the research planning sessions. So, Sala and Annette, anything you want to add?
Yeah, I would say I would like to hear from others. What are their expectations, from this core, or if there's something that they were really looking for into this core and we just maybe missed. This is a perfect time because we are still planning activities moving forward. So, any feedback, is highly appreciated at this point.
Annette, I'll chime in here. First of all, I guess fortunately or unfortunately, the last two meetings, which were intended to kick off our overview of what the activities that are going on in eHealth Hub topics at all the schools and departments, starting with the School of Nursing, has not really picked up participation by very many of our interdisciplinary collaborators. So in a way, we're kind of preaching to ourselves about what's going on at the School of Nursing within these two cores. However, I have to say that when I think of the health informatics data science and these examples that you presented today, they're so innovative that you're also contributing new methodologies to this area. And they're all very closely linked to practice settings, real patients, real clinicians, and systems. So, I mean, it's just would appreciate it that it's not just the dry basic science of machine learning, data science. I think it's something that you can all be really proud of. And we are recording these, so we can share these then with put them on the website and have other people participate. So Ravi Patel is going to speak on the 10th. And I did hear, based on an email yesterday, that Ahmad from Health Informatics Management of the School of Rehab Sciences will do a presentation on the 8th. So we're beginning to get some traction, also from DBMI. They might have a volunteer to present, because these informational sharing meetings are intended to prepare us to hear what's going on from other departments and schools who are involved in the hub, to talk about some possible convergent research going forward. One other thing that I would say is, Salah, yesterday, Youngji and I met with the hub directors and Jackie about the expectation to develop continuing ed lecture programs for the school with Jen Wasco's professional development CEU department. And it seems to me like your idea for the 3 series could be offerings through the CEU site as well, even if it's offered internally for the methodology, which would certainly be up to Sue Sarika and others. So that's another option, because we were told that we're required to do 1 CEU a year. It doesn't have to be a big workshop or symposium. It could be individual presentations. So I think your assessment of the need for the machine learning data science education would be a perfect thing for that. Youngji, what do you think about that?
I mean, I totally agree with you. I mean, there's nothing, no more special things from me. Yeah,
Yeah, I think this is great. It's just like
so great.
trying to find the right venue for it, because the idea is there, and I discussed it with many people. I remember I discussed it with Dr. Sharika at some point, with Yvette Conley, and even with Jen Lindler in the VCR meetings. So yeah, everyone welcomes it. And I have the content, the materials, because I teach this introduction to machine learning in healthcare course to our students. So yeah, I think finding the right venue is just like a matter of like planning. But I believe this 3 series lecture is going to be very beneficial.
And the other goal of this required CEU is to connect with clinicians who might be interested in this topical area. So that's another reason that your topics that you mentioned might be a good place to start.
So I think Dr. Sharika has the hand raised, or she's clapping. I don't know.
My hand is raised. I just didn't want to interrupt people speaking. We can, as I did talk to Salah about this actually, maybe several months ago. So Salah, if you can certainly, if you want, have a kind of like workshop during the CER research methodology series. We could even do it as early as February, the 3rd Monday in February, if you would like, or sometime during the spring term. And then that way, the cost of CEUs is picked up through the CER rather than possibly through the eHealth Hub. Because I don't know if in part of your budget, and that they would require the awarding of CEUs to come through your budget.
Yeah, we still have to clarify that. It was a little muddy in the discussion yesterday, but it sounds like anyone outside the School of Nursing who tapped into it as a continuing ed would pay to get the CEUs. So I don't know how much typically the volume of School of Nursing people attending.
Well, school
for
of nursing
paying-
people, for the most part, at least in the CRE, it's largely school of nursing people, whether it's
Right.
a faculty member, a staff person, or a student of some sort. So that's for sure. Occasionally, we do get people outside of the school of nursing.
So what's the typical charge that you incur at the CRE for participating?
You know, I don't know what it, quite honestly, I don't know what it is. I think we only get, you know how the two different types of, I know we call them CEUs, but there's, you know, they give you two types, participation and true
Mhm.
CEUs. I'm sure the participation ones, there's probably no cost. It's really more the real CEUs where there's
Mhm.
associated with it. I can touch base with Jennifer Wasco about this to find out what is the cost. And again, with that cost for, like, if we did it through the CRE, it probably into cost. It's if you were to do it outside of the CRE, there might be a cost associated with it. And that might be something that might need to be picked up by the hub or by the participant.
Well, we're gonna have, the hub directors want to meet with Jen Wasco, so I think you should be at that meeting as well, so I'll keep you
Okay.
posted.
Mhm.
That would be
But
great.
Salah, you're welcome if you want to even do it as early as this spring, whether it be in the very beginning of the term or sometime later on, or even in the summer term. I think the spring term might be better. Just let me know, because this is a topic that's always been of interest from our participants.
Yeah, we can discuss this offline, but I think, yeah, doing it over the spring term is going to be perfect.
Great. Thank you, Salah.
Mhm.
Annette, could I just make a couple comments?
Absolutely, I'm just among the participants.
Yeah, I know. First of all, I want to commend Salat and Young Ji and Tree. I mean, the work is so impressive. It's innovative. It's critically important. And I'm just really disappointed that the audience here is so small. So I share your frustration, and I'm trying to think about how we can maybe address expanding the audience. And so two things. When I look at this table on the slide, we're looking for people to come and share their expertise with us, and we're not getting an overwhelming response. So I wonder if we should just maybe target people in different schools or disciplines and invite them to say, we would like to hear you come and actually assign them a day, rather than waiting for them to initiate the action of saying, I'd like to come present. So that's one thought. And then the other thought, in terms of sort of the dissemination of this incredible new science within the Pitt system, I wonder if we should start thinking about going to like monthly seminars. We did this in the early days of the eHub. And so each month, one of the investigators was featured. I can remember like Denise spent one entire session explaining of her research and how it was disseminated and how she received copyrights on some of her patient education. Each one of us who had funded research presented our work, and I think we had a fairly decent audience that went beyond the School of Nursing. But today we have so many colleagues that we could actually personally invite. We could work with I'm just blocked on a name. So there's Bruce, and invite him and his colleagues, send out personal invitations, send out, it's not Lisa.
Marissa.
We spoke at her technology session. There were several of us who spoke, and I think it was like in February of 21, we spoke. They invited us, a group of us went down. Jamie was part of it, Jacob, Judy Matthews, myself. So I'm wondering if we can just start beginning to target colleagues or groups in the Pitt system to have some collaboration or invite them to come to our sessions, and that we start presenting, have like Salat do an entire session over his work, the same with Young Ji, the same with people in our other hub, our other core. So I'm just wondering whether we need to take more initiative of promoting ourselves and directly inviting people to attend rather than waiting for them to decide to join us. Just some thoughts.
Yeah, I agree with Laura. That's a great idea, Laura. And I do remember all those sessions we had a long time ago with the eHub when it first started, and we had to present on different aspects and managerial aspects of our studies too, not just the outcomes of the data. But I think targeting certain people, especially the leadership in other disciplinary areas, is the way to go. And I really liked even your quick explanations today and your descriptions today, I think really worked well too. I think this was a real nice overview of each of the arms of this eHub. And I'm glad that you were able to record it, because I think this should definitely be disseminated and used as a template for the rest of us. Thank you.
I think it's a great idea to do the targeting invites for the outside speakers. I mean, outside departments. I've done some of that, but maybe not enough personal reaching out to people. Like we could have each of us invite one of our collaborators directly or something. I think we're experimenting this term with what people really want from the cores. So one expectation is to be brought up to date and to hear about Active's work. But another is to provide the education training, like Salah mentioned. But I guess I wonder if now that if we still have a lot of an uphill sort of climb to get more people involved from outside the school, how do we want to devote, or how do we want to ask people to get involved other than coming in listening to a presentation? And the other part of this experiment is, are we more effective at accomplishing goals when we divide into 2 cores, at least for one of the weeks a month? And I don't know, we'll have to see if this model really is helping or not.
I think one of the ideas for the students, like especially from doctoral students from outside of our nursing schools, I know, well, in my case, well, I'm collaborating with the Sky, and and sometimes even the doctoral students brought the other masters or the first year of doctoral students who wanted to be exposed to the health arena, but for them, well, students always told me they don't know how to be connected with. So, well, it's not like we are not hiring as our research assistants, but you know, if we can kind of promote ourselves for the students, if students wanted to sit in the each of their interest research meetings and wanted to learn more about, and also building connections with this course, I think that can be the possibilities. Or even for our nursing students, I don't think, I mean, definitely right now, all our nursing students are working with their advisors and working as a research assistants, but sometimes they have like more than one interest and they don't know how to be, they don't know if it is appropriate to ask whether, I can just, be in your teams and just, know more about it or not. They only just think, well, I need to just stay with the research assistant jobs or with my advisor. So that can be the possibilities. Any students wanted to be, more get their feet into this, core or this type of research. Yeah, then we can open for students to help them.
For the January meeting on convergence research planning, is this invite only or is open, and how do others know about it and know what the agenda is? I know we're quite far off yet, but I'm just curious again to be thinking ahead of how we can make sure that it's just not a small group of us at this meeting. Nicole,
well,
I mean,
so
and
far,
I know
I
you're reaching out and you're working really hard, and I share your frustration because I know how difficult it is to gather people, but yeah, I'm hoping I can just help some way but I know this is a challenging situation.
Well, so far, the communications have been to everyone who's on the list, and you can see by the email reminder I sent yesterday. I opened up the list so you could see the actual people rather than just a listserv email.
Mhm.
And explained in the earlier communications that these overviews from these representative schools and departments, anyone who was interested, by the end of January, we would do some planning. And so other than that, we'll have to give more messaging about that when the time comes, if there's enough interest. So far, only 2 outside departments have agreed to even fill one of these overview slots. And I sent targeted requests or invitations to 4, 5, 6, 7, about 10 schools and departments, individuals within those departments.
Mhm.
And these 2 are the only ones who, Ravi and Ahmad, were the only ones who responded so far. So we still have opportunities for others, and I put that in the reminder yesterday. But to get to your question about the 26th, we will have to make some sort of real strong message about what that's all about. The goal was that after everybody did an overview, we would start to think about some possible convergence and then look ahead to like clustering different teams or responding to different RFAs or whatever. We may or may not be ready for that in January. I don't know. That was a sort of lofty goal.
So I like our conversation about targeting multidisciplinary groups. Think about the people that we'd like to collaborate with. Think about the people where we want our research to be going towards and to be inclusive of. And I think those are the ones that we hopefully can target to do either the December 8th or the January 12th sessions. And I'm saying that because on January, I don't think this is an unrealistic timeline, because on January 26th, then we come together with those ideas and listening to other people in their area of research. And I think we need to stay focused on the School of Nursing's needs as well. And when we come together to think about RFAs or about research grants, yes, it's really important that we co-investigate on other people's and that they know about ours and like, oh, this is really interesting. Boy, nursing is really doing very good research. And we always get that like a surprise. But we need to go after other people as well. And we have to maintain corresponding PI on these
Right.
mechanisms. I want to make sure that that's very clear, that when we talk about the January 26th convergent research planning, that we are thinking about us being the corresponding PIs on some of these grants, so that the grant can come to the School of Nursing. And so I just wanted to mention that, because again, I think oftentimes other disciplines are very intrigued on what nursing is doing and want us to be a co-I on their studies or co-PI on their studies. But we have to be also maintaining our role as corresponding coordinating PIs.
To add to that, when you're sending out these messages about the 26th meeting, is it possible to include a link to these 2 overviews so individuals can really just sit back in the office and look at this very quickly and get a better sense of the expertise that exists in the School of Nursing and the innovative research that's being conducted?
Sure, we could certainly include all of the a link to all the recordings. And I totally agree that our goal is not to just be at the table for all these convergent research grants. It's our goal as a hub is to build on the work we're already doing and leading projects in a larger scale beyond an individual investigator for this convergent research. And the hope is that most of the time that the nurse investigators, faculty from the School of Nurse investigator would at least be the corresponding PI. Sometimes it's appropriate for multiple PIs and all that. So we don't want to restrict it, but our goal is not to join in as a COI at the table with others like we typically do. It's to take the lead. And the second point is we need to build on work and strengths we already have in order to make the case that we would be good leaders of particular projects. So our overview with Laura and Jamie on the 13th, and this one with the Health Informatics Data Science Core is really helping us see at least some of the work going on at the school that could prompt some of these larger grants. Now, we didn't get everyone represented. So for example, Heidi's work, and you already have a model with Bam Bang and others of convergent research, interdisciplinary. So one other thought is that I raised earlier was, not today, but when we were planning the hubs restructuring, was that it might be helpful from an educational standpoint to find out from teams who are successful in responding to an RFA for convergent type research, how we can be better situated to prepare to respond to RFAs when they come up. Again, not just nursing at the table, but hopefully taking a primary leadership role. So I think today we've thought about a lot of things about the sort of pie in the sky goal for January 26th. We can make it more practical and inclusive and clear of what we're hoping to do.
Yeah, and I think your point is well taken. I also was thinking of multiple PI mechanisms. I think they're very important. But as long as we maintain a corresponding or the coordinating PI, the coordinating center, so that the grant comes to the School of Nursing, I think is really important. Thanks, Annette.
I would agree. This is Susan. I mean, that's what we're finding. Sometimes faculty are a co-PI, but they're not the corresponding PI, and that's becoming problematic.
And one other thing, I think we could encourage convergent research between the interactive health technology and the health informatics data science group, even within the School of Nursing. I see potential with almost every project that you presented today for it to be, inter-school, within the school collaborations and if we get enough of a cluster or cadre of funded researchers, we can put in some sort of a center grant. We have a T32, but we don't have a center grant in any of these topics. And that would be definitely put through the School of Nursing. So that's another opportunity for convergent research planning. It's not just across schools, but within our school. We've tried a couple times before, right, Laura, Susan?
Yes, we have.
Denise, Heidi, some of our previous times.
We've
And
definitely
we
tried,
just
but
miss it.
we
We've
weren't
just
that
missed
far
it.
off. So
Right.
so this is probably a good time to do it again. And again, I just think reviewing these presentations, it clearly demonstrates that the School of Nursing faculty are senior investigators and that other individuals would want to collaborate with us. And I mean, I know in the past, some other people sometimes have said that to me from other schools. Oh, I have no idea what's going on in the School of Nursing, or they have, they just have no idea what nurses do in terms of research. And I think just listening to these presentations, it's just so important for people in other schools and disciplines to learn about what we are doing in the School of Nursing, not just in our hub and all the hubs, but I think some of our work, particularly today's presentation, many people would probably be very surprised if nurses are doing this kind of research. It's just probably the same in the genetic field. It's kind of discouraging sometimes that people have no idea what we're doing. So I think it's really important, again, to spread the word as what of the expertise that exists in the School of Nursing.
I'm going to thank you for the mention, Annette. I just wanted to say, if our goal really is convergent research planning, that a singular focus on the School of Nursing is going to be a huge barrier to doing that. And so I think we need to find a balance between supporting the mission and the what we have to do in the School of Nursing, with also recognizing that to be able to leverage opportunities to do convergence research, to bridge silos, to truly create interdisciplinary teams, we can't always put the School of Nursing first. And
Right.
I think we have to say that. And I think we're in a rapidly changing time, and where, US News and World Report rankings driving science we're going to have to push back against that. And sometimes that means, being a corresponding author or corresponding PI, or a multiple PI where it's not run through the School of Nursing. And, I hate to say that, but I think it's true. Actually, I don't hate to say it. I think the model needs to be changed at the top. If our whole goal at institutions are to be interdisciplinary, if NIH wants interdisciplinary, then there needs to be other rewards that come back to the schools. So.
Oh, Heidi, you're right on. It's definitely a two-way street. I mean, we
Yeah.
have to be on other people that's co-Is and co-PIs and multiple PIs on theirs as well. I mean, that's where it's really nice to be able to, we'll put it in from the School of Nursing, we'll put it in from the School of Medicine, the School of Pharmacy. Absolutely. I'm just talking about the January 26th Convergence Research Planning Day.
Yeah.
And I was just, because absolutely, I mean, we just don't want people to be on ours and us not be on theirs. It's a two-way street. We want to be on, we want both worlds. But I was just talking about the January 26th and the theme of that day, how it should proceed.
Yeah.
Well, can I follow up on that? So I agree that we need a balance. But at the same time, if it's work that we have faculty who are the appropriate leader of a particular area, then of course it makes sense that they would step forward and be
Absolutely.
corresponding PI. So the other thing about and that would be specifically with convergence with other disciplines, which is all what team science is all about. But even within our school, there may be large scale center type grants that we would logically be able to pursue to come to our school in these fields. So I think your point is well taken, and also for the recording of all our interdisciplinary people who might watch this, we're not mandating that the only way we'll participate is as corresponding PIs. But it is, of course, something that every school and department has to think about. When is it appropriate to be sharing leadership, and when is it appropriate for who to take the lead? So maybe that was a good point to be made again.
Yeah, I think so. And I think it's probably even worth a conversation with, the Vice Chancellor for the Health Sciences. I mean, I don't know if that'll ever, I don't know how we would go about doing that, but it's a challenging decision to make about how to engage in these cross-disciplinary, cross-department, cross-school, large projects. And
Yeah.
it's worth discussing, I think.
Well, I know we're almost at time. Does anyone want any last words at all? We're actually beyond time here. And well, I also hope we get some dialogue going with some of the other interdisciplinary people about these very issues and how to make it a win-win for everybody, because we're all in this together.
Mhm.
If there are no other comments, then I guess we'll adjourn for today. And reminder that at least half of the presentation on November 10th will be one of our collaborators from pharmacy. And one from December 8th would be from Health and Rehab Sciences, School of Rehab, Health and Rehab Sciences, the Health Informatics Management faculty member. So thank you, everybody, and I will find a home to post these recordings.
Thanks for all of your leadership.
Thank you,
That's a
everyone,
lot.
for the presentations and the great discussion. Really important.
Thanks. Lauren, is that you, Lauren Narby, on the phone? Yeah, I just saw your photo. Okay, I thought that's who it was. All right, I'm going to
Okay.
stop the recording unless you have something to add.
No, I'm good. Have a good one.
Okay, okay, bye-bye.